Patty, and I'm going to be your nurse for today. Could you tell me your name and date of birth? He told me his name and date of birth. Good. Let me check your ID. Okay. And do you know why you are here today?
It's for head to toes.
Okay, so I'm going to go ahead and wash my hands. So first, I'm going to begin by asking him a few questions about his medical history. Sir, do you have any allergies that you know of? Are you having any medical issues right now? Any health issues? No, nothing. You just came for your annual head to toe assessment.
Yes.
Okay. So the first thing that I'm going to assess is his general appearance, and he has good posture, good hygiene, and he's answering all his questions appropriately. The other thing that I'm going to, the first thing that I'm going to inspect is the head and the face, and I'm going to look for any, or feel for any masses, any lumps. I'm looking for symmetry. So the first thing I'm going to do is I'm going to palpate his cranium. And I'm checking his hair for any discrepancies. His scalp, everything looks nice and healthy. I'm going to inspect his sinuses. Do you feel any pressure or pain there? How about right here? Okay. And also I'm going to ask you to open and close your mouth. Okay. Now the next thing that I'm going to check for is to see if he can feel, if he's got sensation on his face. So I'm going to ask you to close your eyes and you tell me if you can feel here.
Yes.
Here.
Yes.
Here.
Yes.
Here.
Yes.
Okay, you can open your eyes. Now the next thing that I'm going to inspect are his eyes. So I'm just going to look at his eyes, make sure he doesn't have any type of drainage or redness, which he doesn't. So sir, I'm going to have you hold one of these cards, and I'm going to ask you to place it over your right eye. Okay, so now I'm going to place mine on the opposite eye, which I'm going to put it over here. So just keep looking at me. And when you see my fingers coming in, you tell me, okay?
I see.
Okay, now we can switch to the other eye. Keep your eyes on me. Okay, go ahead. Thank you. Okay, so now I'm going to ask him, we're going to do the cover test. I'm going to ask you to hold this, and I want you to focus on my nose, and I want you to cover one of your eyes with the card, okay? Okay, so go ahead and look at my nose. Okay, now we're going to do the same with the other eye. this. Well, let's do that one again. Hold your, now look at my nose again. Okay, keep looking at my nose. Okay. Now go ahead and do the opposite eye. Keep looking. Okay, all right. Now the next thing I want to ask you to do, sir, is I'm going to ask you to follow my finger with your eyes only, okay? Don't move your head. I just want to see your eye movement, okay? All right, so follow my finger with your eyes only. Okay. Okay, so now I'm going to test for accommodation and convergence. So sir, I'm going to ask that you focus on the wall here, okay? Keep looking at the wall. And I'm going to okay, keep looking. Then when I ask you to look at my finger, focus on the wall, and when I ask you to look at my finger, I'm going to look in your eyes, okay? So look at my finger. Okay, now at the wall. My finger again. Okay. Okay, the next thing is the Hirschberg test, and that's with the ophthalmoscope, but I don't have an ophthalmoscope. So what I would do is I would ask the patient to look straight ahead, and I would shine the light towards the patient's eyes. And the light should reflect on the exact same spot of the corneas. And the next test is pupillary light reflex for direct and consensual reflexes. And I would have them focus on an object from the distance, and I would shine a light from the side of one eye, and that pupil should constrict. And at the same time, the opposite pupil should constrict as well. I have a pen light, so I'm going to see if I can try with this. So I'm going to ask you to focus on something that's in the distance over there, okay? Okay. And also the with the ophthalmoscope, I would also to continue examining his eye, I could darken the room, put the diopter on 0, and examine his right eye with the ophthalmoscope. I would have grabbed it like this. And then the other eye with this hand. Let's see. And then I would turn the diopter to focus and find the cup, the disc, vessels, and retinal background. So moving on to the ears. Sir, have you been having any problems with your ears recently? No? So I'm going to first inspect the outer ear. Make sure it's not red, it's not swollen. And I'm gonna palpate this, and does that hurt? Does that feel tender? And on this side? No? Okay. So I would also palpate the mastoid. Does that feel tender? Does that hurt? No? Okay. So the next thing that I would do is I'm going to test his cranial nerve 8. So sir, I'm going to ask you to turn that way, please. You can shift your whole body. So I'm going to whisper a word behind him, and he's going to repeat what I say.
Hello.
Okay, now go turn towards me. Okay. And he said the correct words. And so for this exam, I would use an otoscope, and I don't have an otoscope either. So I would use the otoscope. I'll just use this as my otoscope. And what I'm going to want to do is look, I'm going to pull his ear up and back. I would have my otoscope and look inside each ear. So up and back. And make sure that his tympanic membrane is pearly gray with the light reflex present and that the malleus is visible. So the next thing I'm going to inspect is his nose. So I'm going to look at his skin. Sir, have you had a cold recently? No? Okay. So look for symmetry. And can you look upward? Okay. So now what I'm going to have him do is I'm going to test the patency of each nair, of each nostril. So sir, I'm going to ask that you hold one nostril and go ahead and exhale, exhale, and inhale. Okay, now do the same with the other. Okay, are you having any trouble with congestion? No? Okay, you can put your hand down. Now I'm going to inspect his nares. It would be with an otoscope, but like I said, I don't have one. So what I'm going to use is my pen light, and I'm going to inspect his mucosa, the septum, and the turbinates. So I'm going to ask you to look up. So I would have my otoscope. Okay, you can close, or you can look down, I'm sorry. And everything looks good. His mucosa is pink, it's moist. Now the next thing that I'm going to look at is the mouth and the throat. So I would look at his lips to make sure he's got symmetry, if he doesn't have any chapped skin or anything like that, which is look nice and pink and smooth. He doesn't have any lesions either. So here I would use an otoscope as well, but like I said, I don't have one, so I'm going to use my pen light. So I'm going to look in his mouth. So sir, I'm going to ask you to open your mouth. And I'm going to inspect his teeth, his gums. Okay, you can stick your tongue out. Okay, you can put it back in. Now, another thing that I'm going to look at is his uvula. Make sure that it is midline. So for that, I'm going to have him open his mouth, take out your tongue. My light doesn't want to work. ah. Okay, that looks good. And so moving on, I'm going to move down now to his neck. So I'm inspecting his skin as well. Make sure he doesn't have any rash or any cuts or anything going on with the skin, which he doesn't. So I'm going to assess next his jugular vein distension. So sir, I'm going to ask that you lay down. I'm going to have you turn that way. And I want you to exhale and hold your breath. Okay, that's good. You can go ahead and sit down. That looks good. Now I'm going to palpate his lymph nodes. So I'm going to start here in the submental, occipital, submandibular, cervical, supraclavicular, and infraclavicular. Okay. Now, sir, I'm gonna feel the thyroid. So I'm gonna ask you to swallow, okay? Go ahead and swallow. Okay, that feels good. Now, the next thing that I'm going to do is I'm going to test for his cervical spine, and that is cervical cranial nerve 11. And I'm going to place my hand on one of his cheeks, and sir, I'm going to have you turn the opposite way, okay? Or towards resistance. Okay, good. So now I'm going to place my hands on his shoulders and press. So when I press down, I want you to shrug your shoulders, okay? So go ahead and sit forward. Shrug your shoulders. Good. Okay. Now listen to his carotid arteries for any bruits. So I want to listen to your carotid arteries here. Okay, now moving down to the chest. I'm first going to take a look to see if he has, I can inspect his skin first and make sure he doesn't have any abnormalities on his skin. Sir, I'm going to ask you to go ahead and sit facing that way. Okay, so now I'm going to test for tactile fremitus, and I'm going to place the palms of my hands on your back. And when I do this, sir, I want you to repeat with me 99, okay? Go ahead.
99. 99. 99.
Okay. All right, so go ahead and, can you move forward a little bit, please? Thank you. Now go ahead and face that way. So I'm going to ask you to take a deep breath in and out.